The title of the article I chose for this project was Comparative Effectiveness of Aerobic, Resistance, and Combined Training on Cardiovascular Disease Risk Factors, a randomized controlled trial. A little bit of information about the article I chose. It was done by PLOS One, which is generally respected as an article. They have an impact score of 3.6, which is in the good range, so that's good to see. The study was published in 2019 and done by University of Illinois and Iowa State's Departments of Kinesiology. And the purpose of their study was to look at cardiovascular disease risk factors and if exercise intervention can mediate those. So a little bit of background on cardiovascular disease. It is still the leading cause of death in not only the US, but also just the entire world, with nearly 2,500 deaths per day. And unfortunately, the data suggests that this number is only going to keep increasing over the coming years. There are also several different types of heart disease. Some of these include acute angina, heart failure, heart attack, and even stroke. And a sad statistic that I found while researching for this project was that there's approximately one stroke every 40 seconds in the world. Some of the risk factors that can go along with CVD are hypertension, obesity, sedentary lifestyle, family history, and tobacco use. This map just shows the prevalence of CVD in the US. The more dark shaded areas show a higher prevalence of CVD in that county. So the dominant cause of cardiovascular disease is arthrogenesis, which is essentially the buildup of plaque within an artery. This can lead to a clot that can reduce blood flow in that area, or potentially even have that clot break off and reduce blood flow in a different area downstream. One of the scary things about arthrogenesis is that it can be potentially asymptomatic until there's somewhere around an 80% blockage in that artery. And unfortunately, once it gets to that rate and these symptoms start to show themselves, it can almost be too late because of how far it had progressed. So being able to manage the risk factors that go along with CVD is just that much more important. So moving into the study, they wanted to compare aerobic, resistance, and a combined exercise group's effectiveness in lowering hypertension and other cardiovascular disease risk factors. The reason they wanted to do it this way is because there's a big gap in the literature regarding resistance training. A lot of the spotlight is on aerobic exercise, and resistance is kind of left in the dust per se, and doesn't have a lot of research behind it to show its potential benefits. Their hypothesis was that combined exercise would elicit a greater improvement in blood pressure and cardiovascular disease risk factors when compared to just aerobic or resistance on their own. So a little bit of information about the participants that they chose for the study. They had 69 adults who all had elevated blood pressure without the use of medication, and they were all between the ages of 45 and 74, so a little bit of an older population for this research. Another important note is that all participants were considered sedentary for at least 3 months prior to the study, which essentially meant that they did not meet the ACSM guidelines for either aerobic or resistance exercise per week. Participants were free from all serious medical conditions. This included unstable coronary artery disease, heart failure, and pulmonary hypertension. This was in line with ACSM guidelines and Heart Association guidelines for just exercising with too severe of a condition. Other groups that were excluded included people that had been smoking and people who either were pregnant at the time or perhaps would have became pregnant during the duration of the study. They also mentioned that for all the participants, they were screened by phone to help increase their adherence. They didn't go into great detail about what this screening process was, but overall they did have a pretty good adherence, which we'll look at later, so it seemed to have worked. So the design of the study was that participants were randomly broken into groups that included a control group that did no exercise, an aerobic group which would do aerobic exercise, a resistance group that would do resistance exercise, and then a combined group which would do both aerobic and resistance exercise. The intervention was 8 weeks long and included 3 workouts per week. Both the resistance and aerobic groups would work out for 60 minutes a day, while the combined group would do 30 minutes of each per day. I thought this was really cool to see because a lot of the time with studies like this, they would just tack resistance on to the end of an aerobic workout, which would just increase the overall volume of their exercise, which obviously led to better results. So seeing that they try to keep the time similar to really get a good indication if resistance was helping was really cool to see. It is also important to mention that they had a dietitian to help regulate the diets of these participants because they wanted to exclude their diet from being a uncontrolled factor. And this diet's focus was to avoid weight loss through food and just use the exercise to determine if the risk factors have gone down. So the results of the study showed that all groups that were doing exercise showed adaptations regarding their modality, which is a fancy way of saying that the group who did aerobic exercise saw an increase in VO2 max, the resistance group saw an increase in strength, and the combined group saw an increase in both. Something interesting though is that all exercise groups showed an increase in their upper body strength, which I thought was very interesting to see. The aerobic and the combination group, however, showed a 2 BPM lower heart rate than they did at the beginning of the intervention. All exercise groups showed a reduction in cardiovascular disease risk factors, while the control group actually showed an increase in risk factors. This broke down to the aerobic group showing a 3.4% improvement, resistance showing a 0.1% improvement, and the combined group showing a 0.78% improvement, while the control group only had actually a 9.5% increase in risk factors. It is also important to mention that 96% of the participants completed the program, showing really good adherence. This is just a table of some of the results that they got. The most important one I like to draw your attention to is that the combination group showed a good decrease in peripheral diastolic blood pressure at -4, as well as -4 for central diastolic blood pressure. So their blood pressure definitely went down in those groups. This next table shows the changes in body composition and overall fitness to do with the groups. Couple of important things to point out here is that the aerobic group showed the best improvement in body composition. The the resistance group showed the best results in waist circumference decreasing. And the aerobic group showed a really good increase in VO2 max. The combination group also showed a good increase, but not as much as the aerobic on its own. So just to kind of conclude everything here, combined exercise improved blood pressure, increased cardiorespiratory fitness, and increased lean muscle mass. And that was really awesome to see, considering that the intervention was only 8 weeks long So seeing those improvements in such a short time is really fascinating. The benefits of combined exercise when compared to aerobic or resistance intervention was awesome. So combined exercise showed greater improvements in when compared to aerobic or just resistance. My article also wanted to point out the possibility for future research. This included maybe some studies with a larger sample size. This could either be an increase of the 69 participants that they had, or maybe some different populations to show variation. And another idea would be to change the variation of the intervention program. This could be perhaps increasing the research from 8 weeks to 12 weeks or maybe even 15 weeks, and changing the intensity of the exercises during those weeks to see if intensity plays an important role or if overall consistency and length is more important. And that's my references. Thank you guys so much for watching. And yeah.